Welcome to another episode of the Sandwich Generation Survival Guide. We are here for part 2 of our episode with Christine Davis from Care Collective. Christine is a geriatric care manager, and I am your host, Candace Dellacona, flying solo. Welcome again, Christine.
Good morning. Thank you.
You know, I really enjoyed our last conversation talking about the role of a geriatric care manager for a client, what a geriatric care manager does, and how a geriatric care manager or a care manager in the more general, broad definition can help a patient/client navigate themselves through a quagmire of making sure they have the best care plan in place, particularly in a time of crisis. And so this week, what I would love to talk about is the concept of perhaps doing a little work ahead of time before the crisis and talk about living well and aging well and all the things in between. Does that sound good?
Sounds great.
Awesome. So let's talk about the best way to start a conversation with a loved one prior to a time of crisis about setting a care plan in place. How does that begin, Christine?
It's not a natural conversation to have these days. It seems like it comes out of left field when you have it. And there are some ways that somebody in a sandwich, our age, sandwich generation can approach their parents in a way that might not sound weird. Actually, sandwich generation people are perfectly set up for this because they can say, we just came off of 3 university tours and oh my gosh, now I realize the things that I need to know. And then I thought, well, I need to talk to mom and dad because now I'm starting to think about preparing and just come up with some reason to talk about this. But to say, mom and dad, I don't know what I should be doing for you if there was ever a crisis. I don't know what you want. When can we set up some time to talk about it?
That's actually, I feel like you're reading my mind because I just came off of college tours with 2 of my kids. So thank you for that.
Yeah.
But you're right. So just sort of bringing it up to your parents and opening up the dialogue.
Yeah. If it comes down like a hammer, the door will slam closed too.
Sure.
Yeah. And I'm just curious, if you were to ever really get sick, what's important for me to know? What should I be doing for you?
Yeah.
I don't want to do the wrong thing. And you can also call out the elephant in the room. Like, this is probably one of the most uncomfortable conversations I've ever had with you, but I'm realizing that I'm not comfortable not having it.
I think it could be a really loving conversation too, right? It shows as a child that you really love your parent.
Yeah, absolutely. And I also think that it's sometimes an eye-opener for parents who might not have even thought about this stuff. You'd be surprised.
Yeah.
People don't want to think about their end. It's not comfortable. And we, as a media society, we don't pay a lot of attention to it. In our world, we encounter kind of 2 different groups of people. There's people that are highly organized and have put everything together and have planned for every scenario.
Sure.
And there's people who have their head in the sand that just,
yes,
it's going to happen. I can't think about it.
Yeah. Either way, though, so even if you're an adult child, you may find out that in having the conversation with your parent that they have actually thought about it. And then maybe they'll invite you into the fold to talk to you about what they've already thought about and what decisions they've made. Or it's the latter. It's the people that haven't thought about it. And it's a good time to sort of bring these issues up. And, it comes into my practice often, Christine, when I'm doing estate planning. Obviously, I think you're right that a lot of people, and I don't know if it's an American thing or not, I'm sure there's a lot of sort of cultural information on the subject, but I think many Americans really think that death is not going to happen to them in any sort of real or tangible way. What seems to bring my clients into the office is 1 or 2 things: having experienced someone else's death or incapacity, someone that they're close to, and having that be a cautionary tale, or if it's unfortunate, but a diagnosis for themselves. These conversations are sort of brought to the forefront. But I think, to your point, especially as a care manager, bringing that conversation up and talking about what you'd want allows you to live well. And so how early would you recommend someone bring a care manager into a family dynamic like that? Is that before someone gets sick? Is that something that you can help with at that point?
Yeah, it's not a problem to bring us in before you need us. In fact,
Yeah.
that's sort of like a little insurance policy, and we do.
Yeah, it's ideal.
Yeah. It is ideal because now we're just in your back pocket.
Sure.
Yes. But just in case we're on a list somewhere in your house, oh, you can call Care Collective. This is what they do.
Yeah.
When people bring us in, after that diagnosis, or when things are starting to go sideways, or, the family member that doesn't live close by and visits on a holiday and says, oh my gosh, I haven't seen them in 6 months. I had no idea. People can call us anytime and we just jump in and work with that. But it's so, so helpful. I can't tell you the difference it makes if somebody has a plan thought out.
Yeah. Yeah.
It's your roadmap.
Right.
When the roadmap's not there, we initiate those conversations.
Right. To set the table for the roadmap. And so, things like when clients come to me and say they have long-term care insurance, is that something that a care manager can help orchestrate and start the activation of the policy? Is that something that care managers can help do as well?
100%. Yes.
Great to know.
We're working with a couple of cases now, and I will brag just a little bit. A family just recently, actually, whose long-term care policy was not paying out what they were supposed to for an assisted living facility.
Right.
And we were able to get them, tens of thousands of dollars in reimbursement that they were not going to be able to get on their own.
Amazing. I mean, these insurance companies don't make it easy, right? So here you have a client who thought ahead, saved and spent the money on the policy to make sure that they had the policy to help them pay for that care. And like many of my clients, end up in a position where they're really at a loss in trying to put a claim in for that policy. And not to disparage insurance companies, but they're not so easy in dealing with. And you just brought up a great point. How do you get paid on those claims?
It takes a lot of time on the phone.
Right.
And also just, and you'll know from your profession, but there is a jargon, there's a lingo, a language, there's ways to speak with people so that you know how to get to the person you need.
Right.
You're speaking their language, which we understand it. So we can say, I need this form. Where do I fax it? Or do you want a PDF? And I know how to navigate through. But the elderly husband of the wife who was looking for reimbursement was
overwhelmed.
Yeah, totally overwhelmed. There's no way he would have navigated that.
Yeah. Yeah.
So
that's a great tip for our listeners to even think about the logistics. So maybe not having you come in and coordinate the actual care yet, but let's even just get the policy in claims so that it could be paid for.
My partner just found a benefit hidden in a long-term policy that the family member didn't know existed.
Amazing.
And so that's going to represent several $1,000s a month worth of care that would be covered that wouldn't ordinarily have been.
I mean, that can really be life-changing.
It can be. And so to answer your questions about long-term care, absolutely. A care manager could work with those policies and help you understand what you have so that you know how to utilize it to the advantage.
Yeah. And so last week when we spoke about, having the right documents in place, particularly in a time of conflict, right? So care has started for your loved one, and the loved ones, the children or the advocates, we'll call them, perhaps self-identified advocates, may not agree. And so having documents in place can also help set the table for the geriatric care manager to effectuate the plan that the client maybe thought about before. So let's talk about the documents from a healthcare perspective that are really important to have in place to set the table for having a proper care plan. So in New York, what are the healthcare documents that you would recommend?
Sure, there's 3.
Okay.
Healthcare proxy,
right?
A living will,
right?
And medical orders for life-sustaining treatment. That's it.
Okay, let's
acronym.
Yeah, most, right? So let's talk about each of those documents one by one so that our listeners understand what they need and what these documents actually do. So let's go first with healthcare proxy. Let's talk about that. What is a healthcare proxy?
So a healthcare proxy is a document in which you assign a healthcare agent that has been informed by you of your wishes. And so at any point in your healthcare journey, if you're not able to interact and speak with medical people about what you want, then that agent then steps in to be your voice, not theirs, yours. So sometimes the language gets a bit confusing. It's a healthcare proxy document, but it appoints a healthcare agent.
Right.
And they are supposed to know what you want and be able to act in your stead.
That's right. And so in New York, right, Christine, you can appoint multiple agents, but they can't be appointed as joint or co-agents, because if they don't agree, then Christine has to come in and sort it all out.
Yeah, please don't anybody ever do that. Appoint one and then appoint an alternate. Maybe also understand when the alternate comes into play, what circumstances allow that first person to step back and the alternate to step in. It just helps.
Great advice. Great advice.
Yeah.
And the healthcare proxy is such a simple document to have, but I don't know about you. I've been told so many times by clients, I don't need a healthcare proxy. When I went in for my hip replacement, I signed a proxy at that time. And what do we say about healthcare proxies that are transactional like that? Right? They're not in place after that one transaction, I guess you could call it, or procedure.
Absolutely. And when I hear things like that, I have to be honest with them and say, I'm not really sure what you signed.
That's a really good point. You're right. You're right.
That could have been consent for the procedure itself. I'm not really clear.
Yeah.
But show me a New York State healthcare proxy form,
right?
It's notarized and done properly. And that we can work with very easily. That streamline so much.
I think, too, it's important to talk to our clients about assigning a proxy or the person as your agent and the type of person that should serve as your agent. And this is a conversation that I have often with clients, and you said it really well. You want to make sure that the client's wishes are articulated, not what the agent wants for you, but what the client wants for himself, herself, or themselves.
Yeah.
So the personality of the agent really does come into play, doesn't it?
You need somebody who's good in a crisis, who's able to function when they're sad or upset.
Really good and true. Yes.
That's when you're going to have to be making these decisions.
So a calm, cool, collected person who will allow your words to move through them, essentially, right? And not substitute their desire for yours.
Correct.
Yeah.
That's how it has to happen. That's the whole premise of this document. So choose somebody who you respect and who respects you in return.
Right. And so when one enters into sort of the healthcare arena, you can just bring a copy of the healthcare proxy. Is that right? And show it to your care providers?
Yeah, exactly. In fact, it's very good practice to make lots of copies of that thing, that healthcare proxy form, when you've done it, so that you can have one on file at your primary physician's office, one at your file somewhere, and you can hand them out with very little trouble to whoever needs one in whatever situation it is.
Yeah.
Because I wouldn't rely on hospitals to transfer that kind of information. It gets buried.
I think that's a great bit of advice. I've also heard from physicians that it makes sense, if you are the agent for someone, to take a photo of the proxy and keep it in your phone.
That's one of the wonderful things that technology offers us.
Doesn't it? Yeah.
I walk around with my phone and I just have data information for people.
Absolutely. Especially in a time of crisis, it's nice to have that document ready and available to show to care providers. So healthcare proxy. And then number 2, let's talk about what a living will is.
Yes. A living will is, it gets confused with an actual will.
Yes. People get that confused all the time.
All the time. The concept of it is incredibly simple. It's just a couple of pages, not even, of these are the things that are important to me, the way that I want to live.
Right.
So this is where you talk about, I wouldn't want to live if I'm in this condition. And then it outlines if I'm not pain-free, or if I'm not going to improve, if I'm going to live in a constant vegetative state, like it's
Right.
and attorneys like you are so good at outlining those forms so that you capture the true essence of ways to live well and ways that people can capture, well, and this is how it needs to be for me.
Yeah.
Yeah. It's on paper for that health care agent.
Right.
Look and base decisions on that because that's what you said you wanted.
Yeah. I mean, I look at it and tell me if I'm correct. You know, you as the care manager, you'd be the expert. But I try to explain the living will to my clients as that's the illustration of what you'd want, where the proxy is the person to make the decision, but they get to use the living will as their guide. Is that an accurate statement?
That's absolutely accurate. Yes, because the healthcare proxy document is really just a form signing over to you as the decision maker.
Right.
But how do you make decisions? You make a living will.
Right. It's definitely helpful. And, you know, I will say that as an attorney, I do struggle with the language in a living will, A, because it's so personal, and B, because it's really hard to fully articulate the type of life that one really wants to live, especially in the face of real medical issue, right? Whether it's traumatic health event or a degenerative disease that has led you down a particular path. And so for our listeners out there, you know, certainly the things that you should probably talk about in a living will that I do with my clients, I ask them questions like, if you were probably not going to recover, do you want things like heroic measures? So heroic measures, right, Christine, are what would be intervention with eating and breathing.
Yeah.
Right?
Heroic measures to save my, well, there's heroic measures, which we would consider CPR.
Okay. CPR, right?
Intubated.
Yeah.
So that there's something artificial keeping you alive.
Got it.
And when healthcare professionals are talking to you about no heroic measures taken, they basically mean, should I resuscitate you? Or
okay.
So sometimes people have it. That's not such a hard conversation. As far as specific wishes, you had the opportunity to talk about whether you would want to have a feeding tube placed. What's the pros and cons of that? Artificial hydration, and that's a fancy way of saying, do you want an IV?
Yeah.
And what are the pros and cons of that?
Sure.
Yeah. And these are conversations actually that need to originate with your provider.
Right.
Conversation. And the individual takes the information to you, Candace, or to me, and we put that into the documents.
I mean, I definitely try my best. I'll tell you the other sort of tips that I sort of give to clients to say, why don't you think about this and let me know how you feel, and we'll put it into the document. Do you prefer to die at home? Some people say yes. Some people say no.
It's true. And these are where some of the most meaningful conversations in our world happen.
Yeah.
You know, where if you knew that this was going to happen, what's a good death for you? What does that look like?
Well, you know, for our listeners, we recently had on Eileen Spillane from Befriending Death, this amazing organization. And that's one of the things that she talks about, finding out what a good death is for you. So for any listeners who are interested in that topic, you can feel free to listen to episode 10. But I really think you're right, Christine, that, you know, you have to think about things that are important to you and the standard of life that you wish to live, and make sure that it's fully expressed in that document. One of the things I also add is talking about pain management and palliative care and how that looks.
Right. And so when we start to talk about the more clinical pieces, these wishes, that's where the document that exists to collect that information is the medical orders for life-sustaining treatment.
Perfect segue. Let's talk about that.
Yeah, it's a New York State form.
Yes.
It's online a lot now, but if you ever see it on paper, you won't miss it. It's a bright fuchsia pink cardboard designed to never be missed in a medical.
Yes. And for our listeners, it's MOLST. It's an acronym. MOLST, we call it. It's Medical Orders for Life-Sustaining Treatment.
If you're in another state, it might be physician's orders for life-sustaining treatment. So it could be POLST, but it's a version of this. Most states, I think probably all of them now, have adopted this in their different versions. but it allows you to collect all in one document what all these medical wishes are. So there's a living will that talks about things in general, and it's a little bit more conversational in a paragraph.
Yeah.
A most form has little check boxes. You
Sure.
choose DNR or CPR. You choose IV hydration or a trial of IV hydration or a feeding tube or a trial. You're able to outline specifics of pain management. If you are at home or in a skilled nursing facility, when would you want to go to a hospital?
Right.
Or would you not want to go to a hospital for any reason?
So it gets really granular.
Yeah, it really gets granular and
Yeah.
very specific. And the nice thing about this is that they've taken a lot of the emotion out of it. You just like check the boxes and you got to think about it, but
Yeah.
it doesn't take long to complete. And then it's there and it really does help.
And is that a form, Christine, that you receive from your physician? Where can our listeners get a MOLST form?
Your doctor's office.
Doctor's office.
Yeah.
Okay.
And if, heaven forbid, you're in a hospital for any reason, they'll always have one, and it's a great opportunity to kick it off.
And so having that MOLST form, you fill it out, let's say in a hospital, it's a portable document that can follow you through?
You own it. You can leave the hospital with it. It belongs to you.
Got it. Okay. That's really...
And you can make copies of that.
Yeah.
And similar to your healthcare proxy and your living will, you can include that all together in a little package and hand it to whoever needs to see it.
Yeah, that's great. So for our listeners, that's 3 documents from a healthcare perspective. And I'm going to just segue and talk about quickly the power of attorney. And a lot of times people think that in many ways, it doesn't have a lot to do with your care. And I actually say the opposite, because sometimes the power of attorney can be the key to you qualifying for programs like Medicaid or having access to money to pay for that care later on. So let's talk a little bit about the interplay with the power of attorney too, as well, Christine.
Yes, absolutely. Well, we've learned over the course of our work that not every power of attorney is the same. And so what we're looking
Amen.
Yeah. So there's power of attorneys that deal strictly with finances, but then there's the good ones that have the medical clause in there too, that really add the extra support for the individual who can make some decisions. It's really an extra support to those other medical documents that you already have.
Yes.
In the absence of those other medical documents, if wishes are outlined in a power of attorney, it is incredibly helpful for us to work with.
Yeah. In New York, as an attorney, when I prepare a power of attorney, thankfully, we have this amazing general obligations law that was authored by some really terrific elder law attorneys that advocated at the state level to make sure that we had these modifications in our power of attorney to help support the elderly New Yorkers in our midst. And what you're referring to, Christine, is a couple of things. Our powers of attorney in New York, you can give your agent the power to make decisions related to Medicaid and do Medicaid planning for you, ensure that medical records are provided to your agent so that they can advocate. So while powers of attorney really tends to be in more the financial arena, it bleeds over into the care piece quite often, doesn't it, Christine?
It does. It absolutely does.
And making sure that you have appointed an agent under your power of attorney is in many ways almost as important as your healthcare proxy, because that's going to be the person who's going to make sure that the care can be paid for, whether through your own assets or through the government.
Absolutely. This is one area when it's not planned for well enough can stop care in its tracks. And it takes a lot of effort to work around it.
Yeah.
Because care in this country requires finances, requires resources. And when there aren't enough resources, and there frequently aren't enough financial resources to pay for care that people need, then there's Medicaid. But how do you get Medicaid? You need to have somebody to do it with you. And oftentimes you need to have that power of attorney to work the system. And, you know, that's unfortunately a pretty common issue.
Yeah.
For us.
Yeah.
So it is working on the financial aspect of getting care that people need. It's one thing to know exactly what you want. It's quite another to access it. And that's really where we get into the weeds with people and make things happen.
Absolutely. And, again, it's a testament to the plan, right? And understanding ahead of time before you're in a time of crisis, what you can afford and what care is available to you, because that is going to set the stage for the options that you have.
It does. And to understand not just the care that you think you'll need. I think I'll need somebody 12 hours a day. Well, understand also, do a bit of research or talk to us because we know what it costs.
Yeah.
And we can provide that information. There will be some sticker shock, especially in New York City.
Yeah.
But to be able to look down the football field,
Yes.
how far you have to go,
Yes.
and see, and to work with attorneys like you, Candace, to figure out that pathway.
Yeah.
And
It's true.
Yeah.
And helping clients find the path through, because there is a path through, and it's definitely not all doom and gloom. You and I really have been involved, even together in some cases, on some really good outcomes where we're really able to help families, even families who haven't done the right planning. But, this was a great conversation for our listeners to hear about how to set up a plan and what documents are so important to have in place, and professionals like yourself, Christine, that can be such a resource to families. So I'm so grateful that you joined us again to have another conversation about the role of the care manager and help us prepare our listeners and our families. So thank you again so much for joining us, Christine.
Thank you for having me, Candace. It was a pleasure.
Yeah, you're welcome. And, for our listeners, I'm going to make sure to have Christine's links in our bio, and we'll include all of that information so that if you'd like to get in touch with Christine and you want to start your care plan, you have the tools to do so. Thanks so much for listening, everyone.